welcome one and all to today's town hall. We have a really packed agenda today, so we're going to try and move swiftly to our presentations. A little housekeeping off the top. We will, of course, reserve use of our chat function. I think it'll only be open during our celebrations, but would encourage everyone to pose questions using the Q&A function at the bottom of your screen. Our team of panelists will answer questions in writing throughout the course of the presentations today, so you can review the answers to your questions using the Answered tab. We would ask everybody, right now the feature to ask a question does require that you enter your name as well, which is nice to help in terms of follow-up. If we don't get to your question, we can always send an email to those that don't get a live answer. And again, we'll pause at the end of the presentations, as always is our format for a live Q&A as well. So with that, I know our CEO, Rob, couldn't be with us today, and instead we're lucky to have our EVP of Clinical Operations and our Chief Operating Officer, Sharon Pearson, to kick things off. So Sharon, over to you.
Great, thanks, Aaron. Good morning, everybody, and thanks for joining this morning. And Rob does regret that he can't join us, but he certainly sends his regards, and I'm happy to welcome everyone on his behalf. Before we proceed, I would like us all to pause and acknowledge that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. So we do, as Aaron said, have a really packed agenda today, and for that reason, I'm going to keep my comments very short this morning. We have a lot of important updates, and I hope everyone can stay for the completeness of the town hall today. Many of our leaders are going to speak on a number of topics. You can see we'll have a regular update from Dominic on the status and where we're at with COVID. More on the flu shot campaign and the mandatory vaccine reporting, an update on our Project Odyssey, which is looming closer, and an update on our United Way campaign, which we will be launching. Before we launch into that, though, I would like to give a bit of an operational update, as I do every week, on where we're at. Dominic will provide the more fulsome picture of COVID, but locally, you can see on the slide where we're at with our current numbers. And as I reported last time, far lower at this point in wave 4 than where we were ever with wave 3. So a total of 19 patients, 8 of those patients in the ICU, 15 ward level, and 3 remaining patients on ECMO. So we do see a decline, which we're happy to see in the ECMO population. I will add, we have 2 outbreaks currently, one at 2F at the Mumsy site and another at the palliative care units at St. Peter's Hospital. If we go to the next slide, as I've reported every time, our bed occupancy is extremely pressured with all of our sites, well over 100%. I looked this morning, you could see 116, 124% for some of our acute sites. If we just look at our adult med-surg occupancy, we have this 14-day high of 118%. And we have unfortunately had a few cancellations over the course of the last 10 days as a result of the occupancy. I will remind everyone we are not fully ramped up back to our pre-COVID surgical activity volumes and remain around 85% of our pre-COVID activity. So even in the absence of that, we're seeing these inordinate pressures. One of those drivers relates to the volumes that we're seeing in the ED across all of our sites, and they continue to rise monthly. Along with the volumes, we're also seeing that acuity increase. So just for illustration, I pulled out the increase we're seeing at the Hamilton General with respect to our CTAS-1 population, and you can see that very significant 39% increase when we do a year-over-year comparison from April to September. So significant increase in the condition in which people are coming to the emergency room. And I would also call out that when we look at that increase in activity across all of our EDs, the McMaster site is particularly high when we look at the volumes arriving compared to our pre-pandemic volumes. If we go to the next slide, I did want to spend a little time on children's and women's health today because of the pressures there. And they are seeing unusually high seasonal volumes along with that activity. Our NICU is always extremely pressured, but even more so now, and I would say much closer to the 100%. We know sometimes when we capture this occupancy, it's the timing and it's an aggregate measure, of course. PICU capacity is stretched and work is being done to extend capacity at that site for the critically ill pediatric population. And again, as I reported previously, we continue to see an increase in the number of births that we're supporting at the McMaster site as well. And then other pressures, and I wouldn't want to minimize these other pressures because we certainly talked to them previously, and certainly there's been much broader conversation about the impact that COVID has had on some of the mental health issues in eating disorders, et cetera, across a very large population. In terms of responding to the issues, there's an increased frequency occurring. We've talked in the past about the regional and local meetings that are occurring to help us census balance with our volumes, but also helping us plan proactively for how we're going to manage the ramp up and the impacts of deferred care, along with the ongoing support for COVID. And all of that activity remains, and we continue to respond to the provincial direction in terms of that capacity. And I think that was my last slide. We could go to the next, and it is. So I'll hand it over to Dominic.
Yeah,
thanks, Sharon.
Over to you. Needing no introduction, Dr. Dominic Mertz, everyone.
Yeah, still the same, just a few weeks older. Yeah, you've seen this data. That's how Canada looked like back September 28th, which was the last time that I provided an epi update here. Canada was sitting at 79 cases per 100,000 per week. And as a country, we were on the upswing of the fourth wave. Now, 4 weeks later, you see, okay, fourth wave from that perspective, from a case number perspective, is on the downswing. And as you know, at the national level, the case numbers have been mostly been driven by Alberta, Saskatchewan, Northwestern Territories, which are still struggling, as you can see, still at 328. First Nation reserves also with quite high rates at this point. Alberta came down very significantly, it's at less than 100. Saskatchewan still at 154. You can also see a lot of green arrows here. So other than Manitoba and BC, which is just above 1, the provinces are all declining with their case numbers. For Ontario, we've been sitting at 0.95, so a 5% decrease over time. Next slide. These are the federal models from PHAC from September 3rd, and as previously shown, we've done much better than predicted, even in the best case scenario here. And on the next slide, you will see with the updated PHAC models, we are pretty much as a nation following the best case scenario that was outlined here, which is that pink purplish curve. Next slide. Now, more importantly for us, what's happening in Ontario? As I already mentioned, we continue to have a decrease in case numbers. The line shows you where I expect us to end by the end of this week, so slightly lower than last week, which is comparable to where we've been a year ago in mid-September, still higher than we've been over the summer month, where you can see the dip was more significant than where we are currently at. Next slide. One of the big questions I've been asked a lot is, well, we see so many school outbreaks. How come that we continue to see a decline in case numbers? I'm using this slide here, which shows you the RT, so the reproductive number, how it changed over time. Above the line means there was exponential growth. Below the line means that there was no exponential growth, so case numbers were declining. And in yellow, I highlighted the times during which schools had been open over this year. And you can see there's never been a one-to-one association between you're opening schools, case numbers go up, you're closing school, case numbers fall immediately. It was probably much more all the other measures that were implemented around the same time. All of this being said, transmissions do occur at schools, and it does contribute to some extent to the transmission we see. But you can see that with opening schools, we actually continue the decline in our RT and our case numbers started to decrease with opening schools, which is probably a coincidence and more an effect of the vaccines and everything else that's been going on, but nevertheless, certainly no increase. Now, when you're looking at the next slide, and that's what I mentioned in terms of transmissions do occur, the largest number of outbreaks that have occurred since September had been in the educational and childcare setting, which are the green bars here. Followed by other settings, which is a potpourri of different settings, and then workplace setting, and then the occasional long-term care or other healthcare outbreaks. When you break it down to numbers involved in those outbreaks, and that's on the next slide, you would see that the vast majority of outbreak, well, not the vast majority, the majority of outbreak cases are related to recreational and other settings, 749 cases over those 5 weeks where I summarized the data here. And elementary school were the second most important contributor to outbreak cases with 677. So that's 1/4 of all outbreak related cases. But when you're looking at what's the impact on the total number of cases that we see out there, it's only 2.6%. That can explain the fact that, yes, we do see some transmission happening at schools. However, it has not been fueling the pandemic going into September. I also listed childcare and secondary and post-secondary education here, which are even less of a contributor than elementary schools. Next slide. In terms of hospital admissions, again, at the provincial level, similar to where we've been end of September 2020, still higher than over summer, but certainly a much better spot already than we've been 1 year ago from now, when A, cases were increasing, and B, we already had more people in the hospital. Yeah, next slide, sorry. This is the provincial modeling from September 28. In terms of case numbers, we have pretty much followed the best case scenario here. Next slide. In terms of ICU occupancy, doing slightly better than the best case scenario, as you can see here. Then on the next slide, you see the updated, more recent models from October 22nd, so only 1 week old, where you can see that we continue to follow, or are actually doing slightly better than the best case scenario, which assumed that there are no changes out in the community in terms of behavior or policy. Now we have had changes in behavior, or at least in policy, with the capacity limits being released in some settings. So we will need to see whether this will have an impact, whether we continue to follow the best case scenario here, or more like a status quo low burn kind of scenario, which would be the yellow line, or a slight increase, which would be the red line. So the worst plausible scenario at this point of time. Next slide. In terms of ICU admissions, we don't expect a large difference between the 3 scenarios, given that, again, the vast majority of people are vaccinated at this point of time. And so far, we've been doing better than those 3 scenarios, slightly better though only. Next slide. The Hamilton view here, we continue to decline here after one of the more significant peaks, I would say, within the province with our 4th wave. We are back to where we've been in October last year, or back to where we've been over summer pretty much. This translates in the next slide, please, into our unlinked cases, so the community-based cases where we are in deep green at this point, considering our threshold for non-low epi of 20 per 100,000 per week. And we made the recommendation this morning to switch back to low epi policies with some minor changes. So most likely over the next week, you will hear about some changes in our policies moving forward into the winter. This also in the considering the modeling, which will follow here now on the next slide, which suggests that we will not see a significant increase over the weeks to come. First here, hospital admissions, I forgot that we have that first. We are still running higher than last year in October, so comparable to December last year, but we've been relatively stable, I would say, over the last month and seen a decrease before from our peak beginning of September. Next slide. So these are the models, the publicly available ones, which aren't perfectly up to date. So they are 2-3 weeks old at this point. But you can see here, A, we had been doing better than predicted, even in the best case scenario, and B, the base scenario, the most likely scenario, which is your orange line, would not suggest that we would get back into non-low epi from that perspective. We would, though, if it was the worst case scenario that's been listed here. Next slide. In terms of hospital admissions, those were the predictions from a couple of weeks ago, haven't changed significantly since. We are currently sitting at somewhere between 1 and 1.5 hospital admissions for Hamiltonians on a given day, and that's not expected to change significantly until the end of the year. Next slide. Now, why are we in such a good shape? I think first and foremost, it's thanks to the vaccines. And I saw the question as to why we want our staff vaccinated. It's not black or white. And I think we all have to appreciate that. It's not you're necessarily infected if you're not vaccinated, and you're definitely not infected if you're vaccinated. However, there's a factor of 7 there. So your risk of having an infection at any point of time is reduced by a factor of 7 based on our Ontario data over the last few months, which is a significant decrease in risk when you think about you start off at maybe 1 or 2% of an exposure outside of your household, and that reduces by a factor 7 for an organization. That makes a big difference. And then the other piece is the benefit, the individual benefits in terms of getting the vaccine, a 23 times lower risk of hospital admission, 34 times lower risk of ICU admissions. And keep in mind that the actual numbers are much higher than that, because this is confounded by age groups. Higher age groups have higher risks to end up in hospital or in the ICU, but are also more likely to be vaccinated. So if you do this age stratified, you find an even larger effect than what you see here on this rough analysis based on the Ontario data. Next slide. The science table also shared this in their briefing last week. On the left-hand side, you see vaccine effectiveness and the waning that we see for this is symptomatic infection, and how that waning happens more if there was a short interval between the first and second. So a reduction in the effectiveness of just above 90% into the range of just above 80% with the very short interval. However, in the middle, you see that for severe outcomes, there's no waning happening. So although the risk of getting mild infection or asymptomatic infection increases with time lapsing, we don't see the same effect on severe outcomes, and immunity keeps holding up even if you were vaccinated within the short interval. And most of that waning happens, as you can see on the right-hand side, in those age 70 and older. And that's part of the policy decisions that are being made globally to focus with the third dose on those populations that are most likely to see a significant waning. And as you can see here in the more than 70 for symptomatic infection, there's quite significant waning after 6 months, and this will have policy impact for sure. Next slide. Now, where are we in terms of vaccination rates? This is the provincial view. 87.9% of 12 plus have had at least the first dose. 84% have had both doses at this point of time. Hamilton's still lagging behind. That's on the next slide. We have 3% less first doses. So we are sitting at just like 85% at this point of time. And for the fully vaxxed, it's a little bit more. That's on the next slide, 3.3% behind the provincial average. So it's still, you have some catch up to do in Hamilton and hopefully reach those unvaxxed pockets sooner rather than later. Next slide. This shows you the 7-day average of vaccines administered here in Hamilton. And you can see there was a short-lived bump, I would say, in the week that the mandates were actually put in place, which continued for a couple of weeks. But since we see a continuing decrease in vaccines, but we still see people coming out for their first vaccine, which is great. Most doses at this point are second doses, though, so that's that turquoise line that you can see. The blue line below that are your first doses. Next slide. Where do we have the gaps? It's mostly the 18 to 40-year-old age groups that have the highest gaps in terms of vaccine coverage. This is again provincial data, not Hamilton-specific data, with 71% and 75% being fully vaxxed at this point of time, respectively. 12 to 17 is slightly higher or similar to the 30 to 39 range. And then what we like to see is that the older people get, the higher their risk, the higher their vaccination rates. And it's good to see, but obviously still room for improvement, even in the 60 plus, 60 to 69, there's still 10% who are not yet vaccinated. And when we are thinking about hospital capacity, I would like those from 40 up to be more vaccinated, while the less than 40 are less important, obviously, in terms of impact on healthcare. However, there's one group, and that's the next slide, that the province is doing a blitz this week. Next slide, please. The pregnant women. So that's your age group between those 18 to 40, typically. That's the least vaccinated age group. But with pregnancy, the risk for hospitalization increases by a factor of 5, 10 times more likely to be admitted to the ICU. So in general, more likely to suffer from severe illness. And that's the same that we've seen back with H1N1 when it came across us for the first time, that we saw pregnancy to be a risk factor for hospital admissions as well as ICU admissions. So pregnant women should get vaccinated, and you benefit more than if you were not pregnant in terms of preventing severe disease. Next slide. Now, in addition to the COVID vaccine, it's also flu vaccine season. While we know pretty much for sure that COVID will continue to circulate, we are not as sure for flu yet. We see more flu activity across North America than we've seen a year ago, but still much less than we would have seen 2, 3, 4, 5 years ago. So very hard to tell at this point how significant of a flu season we will have. This being said, it's more likely that we will have an actual flu season than it was last year, given the activity we see, given the reopenings that we have, given the more travel that we do. Hence, it's time to get your flu vaccine. Also a reminder here, that's out of our weekly report from the microbiology lab. We see a lot of paraflu, RSV, rhinoenterovirus, in particular in that age group that we broadly test for those other viruses, in addition to COVID at this point of time. And it wouldn't be surprising at all if flu sooner or later over the next couple of months will be added here. Next slide. So to state the obvious, you can get infected by both COVID, influenza, and all the other respiratory viruses that are out there. As you know, for flu, we have a vaccine, and it's important to get the flu vaccine in addition to your COVID vaccines to protect others, including your patients, because both vaccines reduce the risk of transmitting these viruses, but also protect you directly from being more severely sick, being bed-bound, etc. Also very important to mention, if you haven't had your COVID vaccine, you can get both of the vaccines at the same time. It doesn't impact the effectiveness of one another. Giving both at the same time is safe to do, can be done. You can have an interval of 1 week in between if you prefer. There's no magic time interval that has to lapse between the COVID vaccine and the flu vaccine. Our advisory committee have been very, very clear on that. Next and final slide from my end. I had the pleasure of getting the flu vaccine last week. You can see the hours of the employee health services when you can go and get your flu vaccines at all the sites, typically from 8:30 to 3:30 on weekdays. And of course, you can get your vaccine also through Hamilton Public Health in the pharmacies later on, etc., etc. So please get vaccinated. If you haven't get the COVID vaccine, it's not too late yet. And the flu vaccine would be the next on the menu. Thank you very much.
Thanks very much, Dr. Mertz. Next up on our agenda, I'd like to invite our VP Human Resources, Michelle LaRue, who will be joined by our Director of Labor Relations and Human Rights and Inclusion, Tiffany Roblin, to give us a bit of an update around the vaccine management policy. Where are we at across the workforce, Michelle?
Thanks, Aaron. And always a pleasure to follow Dr. Mertz, and a reminder of why this is important to all of us. So as of right now, 99% of our staff and physicians have reported their vaccination status, a good number to see in front of us, which means just over 12,000 people are fully vaccinated. If you look at the workforce as a whole, that means we've got just under 93% of all HHS staff fully vaccinated. That's 500 more than we had fully vaccinated when we did our last town hall only a couple of weeks ago. So I'll get ahead of Aaron's usual shout outs and acknowledgements and thank those 500 people who have helped us move the marker over the past couple of weeks. We do have 4% remaining unvaccinated at this time based on our reporting. So for that 4% of those who have unreported so far, please remember our goal remains 100% vaccination as we move towards our November 30th date. And next slide, which I will pass off to Tiffany, my colleague, to speak to, and I'll be back.
Thanks, Michelle. While we work towards our goals of 100% vaccination by November 30th, we continue to monitor reporting and testing compliance under our current vaccination management policy. Steps have been taken to have initial one-on-one discussions with those who had not reported their vaccination status, and we continue to issue targeted letters and emails to those who are not fully vaccinated to remind them of their requirements under our current policy. And timelines, of course, to ensure that they're in compliance with our mandatory vaccination policy effective November 30th. For those who are not compliant with our existing policy, whether they have not reported their vaccination status or they are failing to produce proof of that antigen testing when audited by our employee health team, such violations are subject to progressive disciplinary measures up to and including termination of employment. For members of regulated health professions, the hospital is also required to report the outcome of such disciplinary processes to your college. We are also in the process of finalizing those updates to the policy itself to reflect our move to mandatory vaccination on November 30th. The requirement to be fully vaccinated against COVID-19 will be a permanent policy here at HHS, similar to many other vaccination requirements and responsibilities we have as healthcare workers. This requirement has been in place for all new hires to HHS since our current vaccination policy came into effect on September 7th, 2021. We will ensure that our renewed policy is shared with you as soon as it becomes available on the policy library. Again, we will continue to monitor and take steps necessary to ensure compliance with our existing policy concurrently as we move towards mandatory vaccination on November 30th. With that, I will hand things back to Michelle.
Thanks, Tiffany. So November 30th is literally around the corner. Time is flying by, especially in our busy roles at HHS and the hospital. So if you have not done so, please proceed to get your first dose. And for those of you who have your first dose, please proceed to get your second. As Tiffany mentioned, and as we said in prior town halls, as of December 1st, individuals who are not in compliance will be subject to disciplinary measures up to and including dismissal. We do and continue to expect everyone to comply with our policy regarding vaccination. Our next step will be there's approximately 600 individuals who have not reported being fully vaccinated. So we will be sending a letter directly from our president and CEO to those 600 individuals. So if you are not already vaccinated, please proceed to do so. If you have not reported, please proceed to report. Next slide, please. So from an environmental scan, we spoke to this previously, an overwhelming majority of our hospitals in Ontario have or are implementing mandatory vaccination policies. Our post-secondary institutions and school boards are doing the same. And our vaccination passport that many of us have on our phones are fully implemented across the province. It is, the world we live in. So next slide, please. We continue to share these resources. Please, if I was to highlight one or two, remember we have done some communications on the hub on our one-on-one peer support from our vaccine confidence team. Thank you to everybody helping our colleagues who still have questions and challenges around understanding aspects of the vaccine. So thank you to them. The link is there. We've got clinic locations and time. We get calls about where can I get my vaccine. So we've got that. And as Dr. Mertz mentioned, I'm really thrilled to see Ontario come out with some additional supplemental documentation for pregnant and breastfeeding individuals, as that is a question we receive. And we're glad to see that documentation supporting vaccination for those groups. And with that, I'll turn it back to you, Aaron.
Okay, thanks very much, Michelle and Tiffany, for that update. Next up, we have Dr. Barry Lum with us, who's going to give us an update around our Odyssey project and our roadmap to EPIC in our hospital. So Barry, where are things at? How many? 218 days to go, I believe.
That is correct, Aaron. Thank you. And hi, everybody. Just to give you a brief update once again, most of you will now be very familiar with our roadmap. And I would just say that we are rapidly moving towards the end of phase 3 of the project and into the very critical part of the journey that we're on as we begin to train our staff in how to live and work in the EPIC environment. I've said it before, I'll say it briefly again. The most important piece towards a successful go live beyond just designing the system is to having our staff as fully trained and comfortable as we possibly can. So we're well through on our way down phase 3 and heading to 4. And then of course, as Aaron pointed out on the next slide, as of today, we're 218 days away from our go live. Next slide, please. So just a few items that are going on this month. The team is exceptionally busy in the preparation for the training that needs to happen, and then the registration of our colleagues into the system. Everybody who will be involved in patient-facing care in any form or other will need training, and all of those individuals have to be registered in the system so that we can go about setting up the various classes and getting people into the right curriculum for the work that they do. We're also busy with deployment of new devices and hardware. As I've mentioned before, some of you may have already seen the new WOWs on some of the units, and that will continue to be rolled out together with a very large number of new desktop devices and so on. We are continuing our process of recruitment of our super users, and that will continue as we look to find internal HHS individuals who would like to be super users, become experts in the EPIC world, and then support their staff when we go live on June the 4th. We are also recruiting what's called credential trainers. These individuals will be the folks who actually are trained to then train our trainers, and it's an exceptionally important role that will be a full-time role from about the second week of January up until well into the early part of the fall, as those individuals will be supporting all of the training that needs to happen. Most of you will have heard, or if you haven't, that we had a manager and other leaders webinar yesterday to introduce the process by which individuals will be registered for training. There's a second event scheduled for 2 weeks from now, and hopefully come December the 1st, we'll be in a position to start registering everybody. As we complete that registration, individuals will have the opportunity to register for one of the first parts of the training process, which is the e-learning piece that both our physicians as well as all of our other staff need to be able to complete before they go to the classroom to go on with the rest of their training. Physicians are running will be running in a parallel system, physicians and other providers towards that training activity as well. And the last slide, of course, is about choosing wisely, which some of you may have heard. HHS has now been officially recognized as a choosing wisely site. This is level 1. Our goal is to be a level 3 choosing wisely site in Canada, and one of the first EPIC sites to embrace the choosing wisely initiative. Choosing wisely is all about avoiding unnecessary testing and doing the right tests at the right time for patients so that the best outcome can be achieved with the least amount of intervention. This is a really exciting opportunity for HHS, and you'll hear more about it as we move to becoming a level 3 Canadian Choosing Wisely site. And the last slide is the usual slide to say, if you want to be in touch with us, please email us at odyssey@hhsc.ca. Thanks, Aaron.
All right, excellent. Thank you very much, Dr. Lum. Next up on our agenda, we have our colleague Kelly O'Halloran, our Director of Community Medicine and Population Health, who is also one of our campaign chairs for the United Way campaign for 2021. So to give us a bit of an update on the kickoff for that campaign on November 1st. Kelly, over to you.
Thanks, Aaron. Good afternoon. And as Aaron has mentioned, we are kicking off our United Way campaign for 2021 on Monday of next week, November 1st. So we're really excited to be doing this again and encourage you all to participate in this. At HHS, I'm sure many, if not all of us, have seen the impact the pandemic has had on our patients, families, and in some cases, our own friends and neighbors. We see this through job loss, and we're seeing increasing inequities, which are often the result often resulting from poverty, homelessness, and social isolation. As the largest employer in the region, we all have the power to help. Amongst the most impactful ways to provide support is through a one-time gift or a payroll deduction donation. And if you're already enrolled in the payroll deduction, we encourage you to take a look and see if you can increase what you are contributing. If it's within your means, we would encourage you to do this and really appreciate your thought around this. This goes directly to United Way Halton and Hamilton, which is a vital community partner. Everyone at HHS will receive an email on Monday, November 1st, and it will provide further direction around the one-time donation or the payroll deduction. So please keep an eye out for that. For this year's campaign, we're thrilled to welcome back in-hospital fundraising initiatives. Activities differ site to site, so keep your eye open at your sites. But some fun examples include wine and gift cards, survivor games, Chase the Ace, basket raffles, and bottle drives. We also encourage you to participate in organizational-wide activities. What people really enjoyed last year was online bingo, and of course, Dress Your Way days taking place throughout the month of November. The ever-popular terracotta cookie dough fundraiser is back just on time for holiday baking, so we know that will be an exciting endeavor for most of us again. And we will have a new event this year that each of us will have an opportunity to win, a virtual paint night party with a local artist. Our goal this year is at least $90,000, but wouldn't it be great to go above $100,000? And we can all do this together because we are a large organization. So please really take a look at the activities and your ability to participate and go to the hub for further information. Thank you.
Thank you very much for that, Kelly. That's great. We do have a chance now to do a Q&A. There are a number of questions that have been asked in our Q&A forum, and you can review the answers to those questions by clicking on the Answered tab. I know Dr. Mertz has been particularly busy typing answers. Sharon has answered a few as well as others on our panelists. So thanks to them for all of that. So just a reminder, if you'd like to ask a question live, you can raise your hand in the attendees forum, and we'll call on you to ask that question, or you can pose questions in the Q&A, and we'll do our best to get to a few. While we do that, maybe I was looking, there was a number of questions today that thematically I've tried to organize a few just to address some of the issues. For those that might not have reviewed the Q&A, some of these were answered, but nonetheless, maybe Dr. Mertz, I can entice you onto camera to tackle the first one. There was a number of questions around the relative effectiveness of vaccination versus an approach to, why not just use testing, right? Which has been kind of the practice to date. Why not just rely on PPE? I know we've talked about this in the past, and maybe you could underscore your response to that, why vaccination as an approach may offer some superior benefits.
So first of all, I mean, the obvious is testing doesn't prevent infection, right? So first of all, it doesn't prevent the person to get a more severe infection, for the person to end up in ICU, worst case scenario. Appreciating that this is the minority of people, but at the population level, this becomes highly relevant because, as you know, the healthcare system is our bottleneck when it comes to handling COVID in the community. Now, in terms of protecting our organization eventually, testing doesn't have, I would say, the greatest track record when you think about what happened in long-term care. Despite all the testing that was done in the pre-vaccine era, there were still dozens, probably hundreds of outbreaks happening. And suddenly in the third wave, when staff as well as patients were largely vaccinated, you have hardly seen any outbreaks in those settings anymore. So on top of the existing PPE that you would be using and continue to use, on top of the testing in long-term care, vaccines made a huge difference. And we see that difference also in long-term care. Yes, we have a couple of outbreaks that we are dealing with right now. But again, that doesn't mean that vaccines do not work, that vaccines do not prevent outbreaks, that vaccines do not keep outbreaks small. And that's what you can achieve with vaccines. You're not going to achieve that to the same extent with testing. You may be lucky enough to pick up one or the other case that may have worked that given day while infectious, because they would have only become symptomatic the following day. So you could have prevented that one-day exposure. But the benefit compared to the significant decrease you have in risk of infection certainly puts vaccination at a much higher level of effectiveness than any type of testing you can do.
And I know, while I have you, a good portion of the update today was on the domestic circumstances in Canada. So often during the pandemic, we've been looking to the international experience to define what comes next. Maybe I could just press you a bit on what's happening globally. Are we seeing similar circumstances to Canada, or is there any reason for alarm in terms of any circumstances around the world?
So you mean outside of the healthcare setting, more like?
I'm thinking more about, dare I say it, but a fifth wave, or how the pandemic is progressing globally. Are there trends that we should be mindful of outside our own country that maybe you could touch on?
Yeah, I think that the trend that we currently obviously see is that in North America, including the US, cases are coming down very significantly at this point, while Europe is going into the fourth or maybe fifth wave, depending on what terminology you're using. I think that the countries to watch at this point are the Scandinavian countries, including Denmark. So mostly Denmark, Sweden, Norway, that have pretty much stopped all of their pandemic measures, including masking, limited capacity, etc., etc. Over the last month, they do see an increase in case numbers, but we see the same in other countries as well. So it will be very, very interesting to see how those countries fare that have a much higher vaccine rate than many other European countries that instead continue with public health measures, and see what happens. I think there's still an awful lot to learn. Here in Ontario, with the exception of a couple of provinces, I would say, the decision was to use a very cautious approach and to continue with that cautious approach. The benefit of doing so certainly is that we can watch what's happening in other jurisdictions that have already made decisions that we will be making at some point as well. The big question is, what's the right point of time? And it's very difficult to make those decisions going into winter when we know respiratory viruses have it much easier to spread than when going into spring. And that's why some of those decisions certainly have been postponed in many jurisdictions. But as I mentioned, some did that step now, and we will have to watch. And I'm happy to report back on what's happening in those or across Europe with the next EPI update, just to give people a feel. UK, as you know, did that step. When was that? Beginning of July. They have a relatively stable burn with case numbers going up and down, but at a relatively high level, and a level that may potentially not be sustainable going into winter. But again, we will see.
Very much appreciated. Thank you, Dr. Mertz. I did notice also, just want to, again, for the benefit of our broader audience, there was a number of different questions about the application of the vaccine, the mandatory vaccine policy, and the November 30th deadline to people on various different kinds of leaves. I think maybe one of my HR colleagues typed an answer to that. It might have been Patty McEwen, but I'm just curious if one of them could comment just on the, Patty, I see you've come on camera. So anybody that might be on a sick leave or currently on a parental leave or leave of absence for any reason, how should they be thinking about that November 30th deadline?
So everyone who is currently on a leave of absence is expected to be fully vaccinated. So that's the 2 doses plus 14 days by their return to work. If they are not, they will not be able to return to work. So understanding that some individuals on leaves of absence may not know what's going on or may not have heard all of this, we actually just a few days ago sent correspondence to everyone who is currently off work for any reason to provide them with this info and expectation, and to provide them with resources to allow them to get vaccinated before their return to work.
Wonderful. Thank you for doing that. I know there was also a question that's come up more than once around the potential, will we have a mandatory vaccination policies for visitors? I think Kirsten Kroll, you had typed an answer to that that was in our Q&A, but maybe for the benefit of our audience, I can call you out on camera and answer that question. Where's our thinking at right now in our policy around mandatory vaccination for visitors, or what are we thinking around that?
Yeah, this question's been raised obviously for a lot of different reasons as well. We do have a working group that is underway that has been looking at this issue, and of course we're keeping tabs on what else is happening in the province. But our caregivers, essential caregivers for sure, we don't want to put a burden on their backs. They are an important part of our patients' care, and we still have a number of restrictions in place that are doing well for us. But I think the question becomes more so, how can we loosen restrictions even further for our patients? And we think about some of the ambulatory visits, even some of the emerge activity, and even inpatients where, we still have restrictions on hours and so on. Is there some way that we could, now that there's a lower prevalence of the virus that's been moving on, is there some role for vaccination also as we think about how we might be able to loosen restrictions and improve even the quality of life of our patients and our families? It's important for all.
Well, thank you very much. I'm conscious of time. I know we have managed, thank you to all of our panelists, to respond to fully 28 questions in the Q&A forum. So you can take a moment and review the answers to those questions there. If you pose one that hasn't got an answer, if we do have your name, we can send you an email response to the best of our ability, or carry forward that content for our future town halls, or also respond by updating the Q&As that are available on the hub that everyone can access. If you didn't raise a question today and you'd like to, you can also forward it to hhsnews@hhsc.ca. But I do want to leave a moment for celebrations, which are such an important part of our agenda. So we do have the time now. Sharon Pearson's joined me on camera. You can type a celebration into the chat forum. You can also raise your hand to give a celebration live, which is always a nice way to deliver such remarks. And we'll see what we get. So Kirsten, I see you've got your hand up.
Well, I just want to do a shout out for our respiratory therapists. It's our respiratory therapy week. And, you know, kudos, we have such great expertise across HHS, and these folks have worked so hard to help keep our patients safe and our critical team members. So thank you to our respiratory therapists for all the care that you provide and being such great colleagues in our system.
Wonderful. Thanks for that. Just a reminder to our other panelists, you can also raise a hand. Our attendees, you can also raise a hand, or you can take a moment and type something you'd like to celebrate into the chat forum. Could be a colleague, could be something that you've seen, something you've experienced. Dave McKeag, I see you come on camera. Would you like to give a celebration?
I would, and it's just one more indication of the journey that we're on, but what an accomplishment, and kudos to those that were involved thus far in terms of achieving our first status point within Choose Wisely. It's just such a nice thing to start to see this all move forward towards better and safer patient care. So thank you so much, everyone, and we'll look forward to level 2 and then level 3.
Good stuff. Thanks for that, Dave.
Aaron, I see one in the chat from Amy. Thanks, Amy. HHS is receiving 2 awards from the Trillium Gift of Life Network, the Provincial Conversion Rate Award and the Award of Excellence. And there will be a ceremony November 4th from 11 to 12 on Zoom. So thanks, Amy, for that. HHS has longstanding recognition for the work we do with the Trillium Gift of Life, and it's extremely difficult work to do. So congratulations to the team for the ongoing efforts and the contributions we make in this very difficult area.
Thanks. There's I also see so then Bruce Squires left. He had to log off a little early, but wanted to give a shout out to the obstetrics, neonatal, and child health teams for the support provided at our adult sites for several very significant individual cases over the past few weeks. So thanks, Bruce, for leaving that, and thanks to those teams for all your hard work.
And here's another one. Congratulations to Mary Dempsey at the Satellite Health Facility, who's retiring from HHS after a day at work tomorrow. So congratulations to Mary in a very imminent retirement.
It's a way to end your week, isn't it?
Yeah.
I see Leslie Coche with a hand up. Leslie, what would you like to celebrate today?
Yeah, thank you. So Kelly Felzon recently sent a thank you celebration note. As Sharon shared the really high birth rate from the McMaster site, I think it's really important to acknowledge that the McMaster OR team actually went and worked with the team in labor and delivery and helped provide a team every day to support their scheduled C-sections, so we could let the labor and delivery nurses take care of their moms. And a really awesome piece of work between perioperative services and the Women's Health Program, and lots of healthy babies delivered because of it. So a big thank you to the McMaster team and Women's Health.
Awesome. Thanks, Leslie. Kelly Campbell, you've joined us on camera. What would you like to celebrate today?
Yeah, I just want to celebrate the group that's supporting our United Way campaign. Kelly O'Halloran as a co-chair, as well as Lisa Webster, have stepped up again this year to help us. And then there's a whole group of site administrators and their admin supports that support this work, as well as a number of volunteers. It's a major effort to pull this campaign together every year. And so just a shout out to them in advance of the campaign. We know that staff and physicians and leaders will support us going forward, but they have some great plans for some great games and prizes, and please participate.
Awesome. How are we looking in the chat function, Sharon?
Yeah, I see one from Alia, I think is how you pronounced. Gratitude to all HHS staff who've been vaccinated and everyone doing their part to keep all employees and patients as safe as possible. Yes, and thanks for that message, Alia.
Leslie Gillies, I see you with a hand up. What would you like to celebrate today?
Thanks, Aaron. Obviously, everyone's working very, very hard at all of the sites, but just to specifically point out West Lincoln, of course, with return of operating room activity and obstetrics back to the site, there's been an incredibly high occupancy. So lots of great work underway. So thank you to the team and continuing to provide great patient care under those circumstances. Thanks.
Wonderful. Well, we'll leave it as that is the last of our celebrations. Of course, you can always continue to type things in for people to read. But Sharon, why don't I give the final word to you? Thanks to everyone for joining us.
Thanks, Aaron. So thanks everyone for tuning in today. We know you're being pulled in many directions, and these are very difficult conversations that we're having right now. So we do appreciate the time you're giving us. As always, today's presentations and the materials will be posted on the Hub. And with that, we'll close out. I hope everyone has a safe and fun Halloween weekend if you celebrate, and enjoy that. Thank you.